my name is Melanie Buckner. I'm a physical therapist with Memorial Hermann, and I'm just going to be giving you guys a presentation today on managing and preventing injuries in order to help with your dance career. And this will just be in conjunction with the upcoming Day of Dancer Health, just to get you guys ready to go. All right, I'm going to share my screen now. Just wanted to show my face in case it disappears. Okay. Bear with me here. All right, here we go. All right, so presentation today, management and prevention of common injuries in dancers from my perspective as a physical therapist. All right, so today in this presentation, we're going to be covering different types of injuries that you'll commonly see in dancers, and then the mechanisms of how these things happen, and then common areas of the body. We're going to go over prevention a lot and hit that very hard, and then also just some like in-depth injury management of the common injuries that we go over, both when you're in your dance season and in your off season. I know that off season probably isn't a thing for you guys, and that this will just be kind of when you're more focused on taking routine classes and not as many rehearsals or high volume of shows. Okay, about me. Yep, Melanie Buckner. I was born and raised in Orchard Lake, Michigan, which is just a suburb outside of Detroit, Michigan. I wasn't myself a dancer. Well, I did a little bit of dance when I was a kid, but my primary sport was gymnastics. I did that competitively from about 10 to 18 or before I left for college. And then I also coached gymnastics once I was of age and then through college. I went to Michigan State for my undergrad degree in a bachelor's of science, human biology. And then I went to Northwestern in Chicago for my doctorate in physical therapy. And then now, after that, finished that up last year, and now I am a sports resident with Memorial Hermann here over in Houston, Texas. I'm at the Memorial City location. All right, and then just for this presentation, just a disclaimer, this material should not be taken as medical advice and should be used for knowledge purposes only. If you actually feel like you are having pain or you're functionally limited, please consult with a PT or a physician of some kind. All right, so just a stat here. About 84 to 96% of dancers report some sort of injury over the course of their career. So that's the point of this presentation, to hopefully help us to work on preventing that. All right, so different types of injuries that you'll see based on body region. So most commonly, you're going to have things on the lower body just because of everything you guys do in dance with your legs. And you'll most commonly see them at the injuries at the foot and ankle, and then next will be hip, and next will be knee. And then another common spot is the low back or the lumbar spine. Now, these typically happen due to overuse, just the training volume that you guys do. And this can be both to soft tissues or bone, so muscles and tendon or bone. But then also not only just overuse, but also traumatic, like an ankle sprain. And we're going to get into all these examples later. All right, so this was taken by an article from Russell, and it shows causes and contributors to dancer injuries. So the items listed include improper training over here. I think you guys can see my mouse. So improper training, you've got dance techniques that put your body in vulnerable positions, training hazards such as footwear and flooring, and more physical causes like body structure deformities and muscle imbalances down here as well. And then you can see on the right side, a lot of these can be managed conservatively without need for surgical treatment. Physical therapy and a lot of advice in this PowerPoint contribute to ways to conservatively manage common dancer injuries. That's what we're going to keep going with. All right. So a little bit of on prevention, we're going to hit home a few things. And the first thing I'm going to start with is nutrition. This was in collaboration with a sports dietitian resident with Memorial Hermann, Hannah. And she just gave us some great knowledge here with, adequate energy and carbs are imperative for supporting your bones. And if you're not eating enough calories per day, that significantly increases your risk of injury. So when we're thinking about prevention, we want to consider providing ourselves with a recovery snack, even if you can't get to a meal right away. So that's great to keep like in your bag that you bring to dance, or a few of them just to keep stashed. So then when you get home, you can have a larger meal to follow. You want to work on addressing any vitamin or mineral deficiencies you have, and then working with the registered dietitian to ensure needs are met if you feel like you aren't getting the proper nutrition. And then when it comes to return to sport and recovery, um, if you have poor nutrition, it might lengthen your time to recover from that injury. It does take energy, so making sure that you're still eating, even if you're not, or eating properly, even if you're not exercising or dancing as much. You want to increase your protein intake during this time. Think about that every 3 to 4 hours, having some sort of high protein snack. And then your carbohydrates might need to be a little bit lower, but you can't properly use and store the protein if you don't have the carbs. And then what does this look like? So focusing on your fruits and vegetables and whole grains to get those vitamins and minerals, your fats, which she's got some listed here, and then you can consider supplements as well. And then, yeah, just going back to working with that registered dietitian if you are struggling during this time during prevention or just return to sport. All right, and then other ways to prevent, working on rest. I know this is tough as an athlete, but injuries commonly happen at the end of the day or the end of the season or during a performance due to your fatigue. Evidence shows that professional dancers don't take more than 20 to 60 minutes of consecutive rest during their typical workday of dancing. That stat definitely hit me. I thought that was very effective. And yeah, I think back to when I did gymnastics, we definitely didn't take consecutive rest for a long time during our practices. So definitely considering that. Consecutive rest can support prevention and fatigue of burnout physically and emotionally. All right, and then footwear. Yeah, so just considering to change into supportive shoes when you're not practicing that performance or routine at practice. So, of course, this is going to be dependent on your dance type. As mentioned in the last slide, footwork can contribute to dancer injuries. Your shoes have a purpose for your training, so you need them. But if possible, yeah, taking them off at the end of the day and switching into a more supportive shoe, or if you're just going to be walking around, um, not practicing a routine at that time, that'd be a good time to switch, especially for those that practice barefoot. All right, and then oops, before we go on, next we're just going to focus on this physical training. So this is going to be the next few slides here, hitting these hard. So the warm up. This can consist of static, which is just stationary stretching, and stretching where you're moving. A combination of static stretching and dynamic stretching has been shown to improve dancers' height, balance, and range of motion. And this can be sport specific, so it doesn't need to just be, twisting and reaching down. You can make it more dance moves. This is probably going to be what you guys do at the beginning of your practice anyway, so just making sure you're hitting that hard. And then also trying to get your heart rate up in some kind, which we're going to go over a little bit more on the next few slides. And then, yeah, warm up is just super important for increasing that core temperature and providing your muscles with the strength and the flexibility to do what it needs to do for the rest of practice or the rest of your performance. All right, so aerobic training, not just in the warm up, but outside of dance as well, include to try to include some intentional, sustained cardiovascular training, and this will help you reduce your injury. Just put a few examples here, like biking, jogging, rowing, swimming, or like a hit circuit style type of workout. Overall, dancers have been shown to have lower cardiovascular endurance, which can be associated with injuries. This can, really vary depending on the type and frequency of classes and rehearsals and training that you're doing. But so it's been shown that some of the shorter duration exercises during practice, like your routine, um, you won't actually get up to more than that, like mild to moderate intensity during your practice. So yeah, it says here it's been shown, you're only reaching that like moderate to vigorous about 10 minutes per session. And then when you go to your performance or your rehearsal, your heart rate's up a lot longer. So you're doing more. And then this can kind of lead to some of the injuries that we see. We usually see them at those rehearsals or the end of the seasons or the end of the practices. So just think about raising your heart rate and keeping up with that cardiovascular endurance. All right. And then lower body strength and strength training in general. This is what we really want to focus on with you guys since you guys do so much on your feet with the leaps and the jumps. So the lower body strength supports bone health, which decreases your risk of stress fractures, which is commonly seen in dancers. And then you're going to increase the strength of musculature that'll decrease the demand on your joints. All right. And then dance technical training alone is incapable of eliciting strength gains to the point where you're gaining muscle, emphasis on that. And then this is a awesome Instagram page that you guys can follow. It's just a great place to get ideas for strengthening training and exercises for dancers specifically. I had through a few here. We really want to try to target the quads, hamstrings, and glutes, which are all going to be your thigh, upper leg muscles. Muscle strengthening, your parameters for this, you're going to aim for about 8 to 12 repetitions. You should be getting pretty tired towards the end there, and then do 2 to 3 sets of that. And for more muscle endurance type exercises, you're going to go higher reps, lower weight, or you can do for time instead of counting your reps and holding those muscles in that contracted position. I know for you guys, bulking is something that is you can be weary of just because of dance and the way that you want your body to look for your performances. Focusing more on those lower weight and higher reps can definitely help to avoid any of that bulking and you're still able to strengthen. All right, and then not only the lower body, but we also really want to focus on the core with dance. Your core is going to be the driver for all your movements. It's going to help control your whole body while you're kicking your legs up and leaping. So focusing on those stabilization exercises, that here are a few great examples, just holding what you're going to try to do is you're going to try to brace, kind of like someone's like punching you in the gut, and try to keep that low back flat against the table. And here you just want to make sure that you're not moving your body or letting your hips twist at all. And then once you can master these, you're going to progress to some more difficult things, and then into more functional things, which are things like standing, or you can do more dance specific type of exercises. All right, we're leaving the prevention area and we're going to go into talking about just some different common injuries that we'll see in dancers and how to manage them. All right, so first one here, tendinopathy. This is going to be an overused soft tissue injury. It's commonly in the lower leg muscles. So you'll see it in the Achilles tendon, the anterior tibialis, and the posterior tibialis. This usually, as it's the way that it happens on the cellular level, you're basically getting like compression and tension on the tendon of that muscle. That changes the cellular or the cells at the cellular level, and this can lead to pain and decreased strength. So, how does this feel? You're going to feel some pain when you go to use the muscle or contract it, and when you're in that fully stretched position of that muscle. The funky thing about this one is you'll feel sore in the beginning when you're warming up, and then once you get through the warm up, you start to feel a little bit better. But then the next day, sometimes you'll feel worse. So it's a tricky one. All right. So when you're in season, you want to focus on hold contractions, kind of like a wall sit. If you think of that with the quad's working the whole time, but you're not moving, right? So that'll be a hold isometric contraction. These can help to decrease pain, and it'll load the tendon, or I want you to try to load the tendon submaximally, which basically means you're not trying to squeeze too hard. You're just holding in a position that you're working about like 50% or so. And then with tendinopathy, slow and heavy training is what you really want to focus on with strengthening. So not quick, not high weight, or I'm sorry, not high reps. You want to get heavier and slow, and that'll help load the tendon properly. And you want to just try to limit the amount of times that you're stretching that muscle, not just statically, but when you're doing those dance moves. So I know, when you're in season, you aren't going to be taking a ton of time off. So just limiting some of those like full out reps or full out routines, and save for, once a day, or when you're getting closer to your performance, just to help manage some of that pain. Yeah. And then going back a little bit to the stretching as well. If you're having, for example, if you're having Achilles tendon pain, it's common for folks to want to stretch it to relieve the pain. It actually can irritate the tendon more often. And even though in the moment that, the stretch feels good, um, instead you can opt for like light loading to the tendon, like slow releve holds, kind of like we were getting at with the slow strengthening and the hold contractions. All right. And then ice and heat, you're more than welcome to do this if it's comforting to you. Either one can provide if it's what you feel is helping you. And then yeah, with this injury in general, it's normal for some of the exercises like the slow releve holds or the any sort of holds to be like slightly painful, probably on like a 2 to 3 out of 10 on the pain scale. That's normal. And then when you're getting into the off season, unfortunately, these take a little bit longer to heal than some of the other things we're going to talk about today. If you have the time, or the pain, just becomes a lot worse, these are going to be the 3 phases that you're going to focus on, which the first phase is those holds for quite a long time. And during the rest period, you can either just rest or work on like a core exercise or something different to keep your body moving and your heart rate up. And then the phase 2 is that slow and heavy strengthening of that affected muscle or tendon. And then 3 is when you're starting to progress to return to sport. This is a great one to consult with a PT on if you think that you have a tendinopathy and you do have some time to rehab it properly. All right, next we're going to move on to hip impingement or labral tear. This is also an overuse bony or soft tissue injury. So the way that this works is you've got your hip bone and then your leg bone, and your hip bone or your leg bone can kind of have a little bit of an extra bony piece that makes it just a little less spherical. So then when you start to move your leg, the motion isn't as smooth. It can kind of contribute to that pinchy feeling. And then over time, since it's not moving perfectly in that joint, it can kind of tear on the labrum and just cause some fraying, and that'll give you also some pain, and it'll decrease the optimal function of that hip joint. And then how does this feel? Sometimes you'll feel like clicking, catching, or popping. That's painful. It'll be deep in the hip. And yeah, it can feel like groin pain or the C sign like I have over here, where you just feel like you want to grab right inside that hip, and that's where you describe your pain. And it'll most likely get worse with dance. All right, for this one, in season management, yep, you want to just decrease the time repetitions you're in those aggravated positions. So those deep squats or those like higher leg kicks above 90 degrees. The hold contractions can help to decrease pain, and the joint mobilizations there. I have two pictures here as well. These can help to offload the hip and then just improve that range of motion. So you want to do these before dance or before you're going to work on some of those stretches, just so that you can get to that full end range of motion that you want, and hopefully we can keep it there with some strengthening. So yeah, then moving into off season, really want to strengthen up those hips, and that'll be those same thigh muscles, but focusing on a little bit more hip specific. So your hip flexors, your internal and external rotators as well. And then you're going to stretch any tight muscles that feel like they've lost some of their flexibility. And then continuing with those joint mobilizations. With this one, if pain isn't getting any better or you feel like it's progressively getting worse, it's definitely worth consulting another healthcare provider. All right, onto the knee. So patellofemoral pain syndrome. This is due to overuse, and it is also a soft tissue injury. So it's going to be right there, usually at the front of the knee, and it can be due to too much load or some improper movement coordination on that kneecap on the two leg bones. Then that can be due to some muscle imbalances, and then also just decreased flexibility or joint mobility if your kneecap isn't moving as well. All three of these things can just lead to improper tracking of that kneecap, which can give you some pain. Yep, you'll feel it to the front of the knee, and it can get worse with dance or those deep bending squatting positions. Sometimes you can also note some non-painful clicking. With this injury, it gets a lot better with strengthening, which we're going to get into on the next slide. This can or I'm sorry, this is totally manageable through exercise and retraining with some mechanics. This is different from some of those traumatic knee injuries, like you'll hear about the ACL or the meniscus tears, where you'd have more of like a traumatic mechanism. This one's going to be more of that overuse over time, and usually doesn't have too much swelling or stiffness with it. All right, so yep, in season, keeping that kneecap nice and mobile. You want to stretch tight muscles, and then yeah, like we talked about, strengthening. This one's going to be driving home that strength and motor control. So we're getting more into the motor control. That's going to be a lot incorporating some of those balance and single leg skills. And then yeah, off season, you really just want to hit home those leg muscles that we had talked about on the lower extremity strength back in strength training. All right. Next one, we're going to do stress fracture. This one is an overuse bony injury. So this is, you'll commonly see for the dancers in the foot, the lower leg, or the low back. We're going to get to the low back a little bit later. This happens due to just repetition, so repetitive bone stress, or it could be like a quick ramp up if you took a long time during your off season. You actually took some time off dance and then you came back without that proper adequate recovery time that our bones need to heal and to just accept all that new load. These can happen more frequently if we don't have the proper nutrition or irregular menstrual cycles or just decreased bone health overall. This will feel like a constant local ache, and that's bony spot. It'll be tender probably to touch. Swelling you can note, and it'll be worse with dance or activity in general. All right. In season, unfortunately, this is one of those that we don't want to push through. It could possibly lead to a full fracture. In usually there's always going to be more damage over time. It could also lead to improper blood supply, which all these things will just take longer for you to come back and to heal properly. Also, when you're dealing with this, you might start, to compensate and dance if you keep pushing, and then you'll injure something else. So, definitely one that we want to consult a healthcare provider for and get the best care so that you can move forward appropriately and quickly. And then during that time that you're going to be taking some time off, it's super important to get the adequate rest. The rest will control the inflammation and it'll promote that rebuilding and healing of the bone. Um, Usually with stress fractures, we want to offload, so take some time completely off. So usually this means either like non-weight bearing or a walking boot of some kind. And then it's going to be a slow progression, from that walking boot into not in the walking boot, and then slow progression, strengthening back to get to you to return to sport. You're going to address all those muscular imbalances, and then from there, start to add in more dance specific type training. All right. Next, we got the low back, so lumbar instability or spondylolysis. This is an overuse bony injury. So, with all that repetitive extension that you guys will do in dance sometimes, you'll get it could lead to a stress fracture at the lumbar spine, which is over here in our picture. Here, you see the little crack. This will be more of the spondylolysis, and then that can also, once it starts to crack, it can start to move forward, and that could contribute to some numbness and tingling in the lower body. Before the stress fracture, you can just have instability, which is just not engaging those core muscles properly. So it's kind of a graded injury that we want to hit, or we want to find in that lumbar instability phase, treat it so that it doesn't keep progressing. So how do these feel? You can feel some catching when you're moving into those extension or flexion positions. It'll probably feel work with back extension. And then, especially with the moving from the instability to the spondylolysis, you'll start to feel the deep local ache. And yeah, as I had mentioned, then from there, you'll start to feel the numbness and tingling if it progresses that far. But we're going to catch it before. All right. In season for instability, we really want to work on core stabilization, strengthening, which here are some great ones below. And then, yep, just keeping your hips and your upper spine mobile. Usually you have so much mobility in those segments in the low back that we neglect the upper back and the hips. And that could have contributed to the injury. We want to, decrease some of the repetitions that we've been doing of the back extension. So limiting your jumps and leaps at practice or your routines. And then try to lower the impact that you're doing to your body. So try biking or the elliptical instead of running, and just having those impact during those routines or what you need for dance. And then during the off season, we're going to kind of have just a more aggressive version of that. In season, you want to continue to work on, when it comes to core stabilization, just increasing your plank time. So forward, sideways, and extension planks. And then, yep, you're going to progress from simple core exercises like the one I have over here on the left, and then moving into more perturbations, and then into some functional standing or dance related moves that require that core engagement. All right, and then just a little bit on that nerve related pain or that numbness and tingling that you can get into the legs. It can also feel like burning pain. This is due to surrounding the spine, the repetitive abnormal forces that are on those nerves. Due to those forces, it kind of just causes like a mechanical irritation. And then with the mechanical irritation plus, the injury that's surrounding those nerves in the back, you'll start to release some inflammatory substances, and this will just lead to a chemical irritation, All these things our nerves don't like. So, what we want to do for this is we want to move the nerve and we want to stabilize it, so not overstretching it. And these are some good examples of, we call them like nerve sliders that just kind of help move the nerve appropriately. Um, and yep, these ones, both of these are great, so you can give these a go. All right, and then this is going to be our traumatic injury that we talk about today. Is going to be your ankle sprain. So this is going to be, what you did, which you probably twisted or rolled it. You fell, and when you fell, you stretched out the top and the side of your ankle, which we call excessive plantar flexion and inversion. And this is going to feel, like a sharp local pain right to that site. You'll notice some swelling and bruising typically as well. These ones can kind of be on a spectrum, different, they're graded differently. So as we go into the in-season and off-season management, it could differ just based on where you're at with your ankle sprain if you had a grade 1 versus a grade 3. But of course, right after you sprain the ankle, you want to rest during that acute phase, decrease your jumping and your leaping, especially if it's painful. You want to ice and elevate to get some of that swelling out. And super important during this phase to just keep the ankle mobile. So just trying to move it. We like to do like ABCs with our feet, trying to draw it with your foot just to keep the ankle moving. And then from there, you're going to progress to some ankle and foot strengthening. A great way to strengthen is to work on your balance to help build up some of those like little baby foot muscles. So I have some examples here. This one's going to be more of just your standard foot muscle strengthening, and then we're kind of getting into some of the balance with these three. During your off season, you unfortunately, just in general, this was just a fact, but you're just prone to getting more ankle sprains once you've had one. So during that off season, just hitting home the strength and the balance exercises. The balance exercises are going to also strengthen your foot. So it's 2-for-1 deal. And you really want to try to make your balance challenging. If it's too easy, try to find something a little bit harder by using a different surface. All right. That's what I have for you guys today. Thanks so much for tuning in. Yep, I'm Melanie Buckner, and this is my email if you have any questions. And my mentor, Hallie Ward, who was a dancer herself, she helped me review this PowerPoint, so I have her email there as well. And also just wanted to plug, we have a dance clinic every third Tuesday of the month. It's a free one-on-one 30-minute eval with a physical therapist, and we'll take a look at you, and then we'll give you some exercises for home that you can take with you. This is over at our Rocket Sport Medicine Institute at Shepherd Square. Locations here, times here, and you can sign up through Dance Source at the link below. Awesome. Thanks so much for listening, guys.